Wes Streeting, the Health Secretary, accuses Nigel Farage of Reform UK of miserablist vision for the UK. And he said this because he accused Nigel Farage of not believing in a universal health service free at the point of use and of having a poverty of ambition for the UK that Labour, he says, utterly rejects. Now, the accusation that Nigel Farage doesn't believe in a universal health service free at the point of use refers to a comment that he made from the BBC election debates. Let's have a listen.
There are countries right next door to us. There's one country, France, that has a very, very different way of funding the NHS. It's rather like those that can afford, through their taxes, pay into an insurance scheme. Those that can't afford it don't pay in, so it's for the mutual benefit of everybody, and it's managed as if it was a private company, and their returns on stroke, heart and cancer are better than ours for exactly the same sum of money.
Well, that's the thing, is that that's not the only comment that he's made supporting privatisation of the NHS. He also said, way back, the clip came up on my TikTok feed, that we wanted to move to an insurance-based system.
Have to move to an insurance-based system of healthcare. Frankly, I would feel more comfortable that my money would return value if I was able to do that through the marketplace of an insurance company than just us trustingly giving 100 billion a year to central government.
And also, it's not the same amount of money. It's not the same sum of money that France have been putting in. They've been putting more money than us into healthcare consistently for years and years and years and years. During the austerity period, we were paying 9 percentage points of GDP on healthcare. At the same time, France was spending over 11% of GDP on health. They have been investing in the healthcare system far more year after year after year from 2010 until now. This is an austerity problem. Again, people like to try and think of the NHS problems as being uniquely in the last 4 years, but that's not true. The NHS problems have been getting worse ever since 2010 as the waiting lists have continually increased due to lack of funding. People are trying to say, well, look at the funding now. It's very high. It's the highest it's ever been as a percentage of GDP. And I'm like, well, that doesn't matter because you're trying to make up for underfunding for the last 10 years of austerity from the election of the coalition to the start of the pandemic. You're going to have to spend extra to fix those shortfalls for that 10-year period and also deal with the problems that have been created by the pandemic as well. So actually, we are still underinvesting even at record highs because we have to deal with the problems of austerity and the underinvestment we have to deal with all the way, fixing the foundations, lol. And then on top of that, dealing with all the extra spending that's sorting out the problems that were caused by the pandemic increase in NHS waiting lists.
We're joined by Sarah Reid, an expert on international healthcare models at the Nuffield Trust. Welcome to you, Sarah. That final sentence of Nigel Farage, is he right that the outcomes in those key indicators, including stroke and heart attacks, are better in France for the same sum of money?
No, I think looking at the evidence, we don't really see that. So it is true that other health systems that have an insurance-based model or a different approach to funding, like France, the Netherlands, Germany, that these health systems do better on some key indicators, cancer survival, rates of death from avoidable causes, these things. But so do other countries that have a system that looks a lot like what we have in the NHS. So Denmark, Sweden, Norway, those are tax-based, universally accessible health systems that also perform better on those indicators. So I don't think I think it would be an oversimplification to say that a certain type of funding model or a certain type of approach to financing healthcare gets us these different outcomes. That's just something we don't really see.
Right.
Again, absolutely correct. Based take there. And again, it's because these people didn't just strip away at their healthcare service after the financial crisis. They didn't just go, our healthcare service isn't rated #1 in the world. Let's just cut it down to size for no reason whatsoever.
That's on the outcomes. Does it cost the same?
No, I think if anything, what we see in those countries, something that unites them is that they all spend more on healthcare than the UK. The health systems I just described, tax-based or not, those governments are putting more towards their health systems than we are doing in the NHS, and they're getting different things as a result. I think we see in France, if we're going to focus on them as an example, they have more doctors, more nurses, more hospital beds. This might be the reason why these health systems are performing better than we are at the moment here in the NHS.
How much more do they
And again, going back to what I was saying before, and this isn't just a current thing, this is a historic problem as well. As I said, France just continually spent money on their healthcare service to upgrade it, to expand it, to invest in it, to have a higher level of inventory and number of beds. Like in the UK, we have some of the lowest number of beds per capita because capital funding just got slashed under George Osborne. Like, he's the reason that we're in this problem right now. So it's not just a problem of current spending, it's historic spending too, which they've also done better than us.
They spend, as a sort of ballpark, France per head, for example, than the NHS.
Yeah, so the French government spends about 26% more per head than we do currently in the NHS.
Thank you. Sarah, stay with us while we talk to our other guests. Zia, respond to that. The outcomes may be better in those key indicators, but it's not down to the model. It's not down to a social insurance model or a tax-based model, and it costs more.
Nigel has been crystal clear that under a reform government, when he's the Prime Minister, the NHS will remain free at the point of use. Both my parents had a career.
You missed out something there, Zia. You didn't say publicly funded free at the point of use. You didn't say publicly owned and free at the point of use. You just said free at the point of use. That doesn't mean you don't have insurance payments. That doesn't mean you don't take the stock and privatise it and then lease it back, which is what's happened every time we've privatised something. Very, very clever rhetorical flourish there, because by saying it'll be free at the point of use, you do not preclude further privatisation. You do not preclude moving to the France insurance-based model outside of like the co-pays that they have to do. If you are paying an insurance premium extra for being, of a certain level of income, then it's still free at the point of use, but it's no longer publicly funded free at the point of use. At least Wes Streeting, who wants to do private contracts and private subcontracting and increase private involvement from NHS spending, he still thinks that it should be publicly funded. He doesn't believe in an insurance model like these people do.
In the NHS, my mum still practices as a nurse. They've given 50 years of service between them as frontline NHS workers. And do you know what they tell me consistently over decades at the dinner table? They've told me we need a lot more frontline NHS workers. We need a lot fewer multi-six-figure salaried administrators. And those administrators are
And that's just nonsense, by the way. The idea that the UK spends loads of money on administration is just total nonsense. In fact, we are far below the OECD average in terms of the money spent on administration. When you look at the Darcy report, when you look at like the internal report from somebody who's looking at the NHS structurally, you see that actually we under-administrate our NHS. To say that we are over-managed or over-administrated as a healthcare service, it's not true. It's just not true. Unless like the majority of OECD nations are all over-administrated, I could maybe see the point, but I've not seen any evidence that this is true other than just hearsay.
Proliferated. The NHS clearly is not working. Everybody watching this at home knows when you try and get a GP appointment, if you try and get a dental appointment,
yes.
A&E. Last year, the ONS said over 50,000 British people died because of undue waits at A&E. So we absolutely need more hospital beds.
But what I'm trying to test is what Nigel Farage said, which is that if we had a social insurance model, not only would our outcomes be better, it wouldn't cost any more money. And Sarah Reid has quite clearly said that is not the case.
Respect, that's not remotely what Nigel Farage just said. He made an observation about the French system. He did not say that we should replicate that system, nor that it would be better for us.
He did say that we should replicate that system in the past. He said it on Question Time that we should think about moving to an insurance-based model when he was questioned about this. He has said in interviews that we should move to an insurance-based model. That clip that you showed talked about the different outcomes in the French model, but there were other clips of him that you could bring up that explicitly do say either we should consider moving to an insurance-based model or that you think that we should. Editing no justice here. I just want to look back at the original clip that they took from the debate, and the BBC cut off the first thing that Nigel Farage said. Listen to this.
The more money we spend, the less delivery we get, which means the model is wrong. The model through which we fund health is wrong.
So this is Nigel telling us he doesn't believe in the NHS. This is what he's doing. He's telling the public he does not believe in the NHS.
No, I'm telling you,
want
the
to
funding model,
privatise it. That is what you want to
do. And you in Scotland, of all places, I mean, look, the NHS is very badly run. Let's change the funding model.
We'll not
Would you like more private? You'd like more private healthcare?
Invest in our NHS, not crush it.
Let's change the model. Now, the NHS, it isn't funded through national insurance. That's a nonsense. It goes into the pot. There are countries right next door to us. There's one country, France, that has a very, very different way of funding the NHS. Let's change the model. Let's change the model.
So he does actually want to change the model. Zia Yusuf is chatting shit. And for some reason, the BBC decided not to play that part of the clip. I wonder why.
in the UK.
So what is the system? So hang on. All right. Well, what is the system? What is the system then that Nigel Farage is proposing?
Well, we have got, unfortunately, the next general election is years away. We are working really, really hard to ensure that our prescription for fixing the NHS will actually work. I want to make this important point too. Under the Tory government, 14 years, the net population growth was 6.5 million in that time. Do you know how many net new hospital beds were built?
No.
0. Not a single one. And you can draw a direct line between
that and the 50,000. I want to know what you want.
Because
OK, so you're saying austerity and lack of investment in the NHS is bad, Zia. We agree. We totally agree on this point. I am not going to contradict you on this idea that we should have been investing in beds. Why is it that your plan for government that you had in the election in July was to slash state expenditure by 5%? Presumably that includes the NHS, right? Where are you going to get these extra beds from? Like, you're the people who are promising even more austerity in your own platform, at least you did in July for the election. Where are these extra beds coming from, Zia? Please tell me.
Because it's always very easy to criticise and sort of break down what other political parties are proposing and then make a statement. And that, yeah, but hang on, but then make a statement. The implication from Nigel Farage was that France has a better system of healthcare. Not only is it better, but it costs the same as the NHS. Well, we've heard that it may be better in certain indicators, but no better than other countries with a tax-based system, and it costs a lot more. Would you be prepared to spend 26% more per head of population here to get those better outcomes?
I find it extraordinary, the attempt to twist what Nigel has just said.
I'm not
Nigel
twisting.
made a very specific observation about France, about specific outcomes in specific categories with respect.
Let's play it again. Let's play.
Well, then you can at least try and say what you think that the outcomes should be. Again, you have said plainly that your only response is it will remain free at the point of use. You refuse to answer the question on the actual model.
Well,
That's not what he said.
Let's play the clip and see what people think.
There are countries right next door to us. There's one country, France, that has a very, very different way of funding the NHS. It's rather like those that can afford, through their taxes, pay into an insurance scheme. Those that can't afford it don't pay in, so it's for the mutual benefit of everybody, and it's managed as if it was a private company, and their returns on stroke, heart and cancer are better than ours for exactly the same sum of money.
Is he advocating that system or not?
No, he's making a very specific point about France, and with respect, you have turned this into him quote, advocating
everybody
for France.
Everybody would take that. All right.
Let's change the model.
And it's so funny to me. Yeah, he was just saying it for no reason. He was just bringing it up out of the blue. Just a fact, a random Alan's fact of the day. He wasn't making any avocation. No, how dare you try and suggest that he was bringing this up in a very televised TV debate during the election where everyone's going to be watching him about views he had. And he was just saying it for no reason at all. No, how dare you insinuate such a thing?
Well, let me just go back.
Nigel has been crystal clear.
Well, it is not crystal clear.
The NHS will remain free at the point of use.
All right,
Publicly funded, though? Publicly funded or just free at the point of use?
Let me go back to Sarah. Is that possible? Let's say we imagine that Nigel Farage is adopting a French-style social insurance model. Would it be free at the point of use, Sarah?
Well, I think what's interesting using France as an example is that they're also different than the NHS, is they have a much broader set of co-payments or user charges than we do in the NHS. So most people in France will pay a flat fee or a percentage of their healthcare costs in addition when they use, when they see their primary care doctor, go to the hospital. Yes, it's true that about 95% of the French population also has a form of insurance to cover the costs of those user payments, but I think this creates a barrier to access for some people in France, particularly the people who have, the worst off with the lowest incomes or who are sick or have multiple conditions to navigate. So I think we have to be really careful about what lessons we draw from other countries, and there's always trade-offs involved.
All right. Thank you very much. I mean, Polly, outcomes are better in some of those key indicators, and that will interest a lot of people watching this programme. Should it be looked at?
Well, I just want to get some further clarification from Zia, because at the weekend, no, this is important. At the weekend, Nigel Farage said everything was on the table, including, for example, the French model, which is about £2,000 a year for a pensioner. So I just want to clear up, when Nigel says everything's on the table, is the idea of pensioners paying £2,000 a year extra to to cover their health insurance, something that would be considered or would be an option for reform.
The NHS will remain free at the point of use
so you pay
for everybody.
So you're not ruling out an insurance system then? Because that's free at the point of use. You're paying through social insurance. That is an increase in your insurance payments monthly, yearly. Your annual contributions increase. But when you go to the doctor, when you go to the hospital, you don't pay at the point of use. You're paying an insurance. Again, this is why when Wes Streeting talks about it to cover up the private sector subcontraction, but without changing the funding model, he says publicly funded, free at the point of use. You very crystal clear. It's really important you understand. There's a reason why Zia Yusuf is not saying publicly funded and free at the point of use, because he wants to leave the door open for this social insurance model, which is not publicly funded, but is free at the point of use. Really important distinction.
When reform are in government, but let's be really clear about it. The NHS is already broken, partly because of catastrophically poor management and no political leadership, and a population explosion. Neither of which is going to change for the next 3 to 4 years. And so we are going to have a policy for the NHS that is going to be fit and ready for when we are going to come into government, which is 3 to 4 years away.
Paid by pensioners as an insurance policy in order for them.
Can I just bring the others?
The NHS will remain free at the point of use.
So they'd have to pay extra.
The NHS will remain.
You're not ruling out pensioners paying extra.
No, but let me bring in.
He's not denying it. So pensioners could pay £2,000 extra, or for example the American option, which is £25,000.
All right, you two. I've heard enough from you two. Well,
there you go. Again, he was asked multiple times to confirm they wouldn't move to social insurance, and all he said was, we will consider social insurance because that isn't publicly funded but is free at the point of use. So there you go. There is your answer, people. If you're considering voting for Reform UK, enjoy your social insurance payments because that's what they want to do. I'm sorry, if he didn't want to do it, he would say no, and he's not saying no. He is explicitly making a claim that allows it to happen. If you enjoyed the video, make sure that you like and leave a comment. That helps the video out in the algorithm. If you subscribe and ring the bell, it'll let you know when I go live. I stream every day on YouTube and Twitch. You can also follow all of my socials down in the description. And if you want to support me in a more financial manner, there's a join button for membership to just 99p to be a member on YouTube, as well as a Patreon, and there's some merch there as well. And hopefully I'll catch you on the next video. Take care.